Hi, my name is Bryn, I'm an osteopath, and today's talk is going to be on pain in association with We Connect, a FIDEM charitable foundation. So when we think about pain, we think about an unpleasant sensory experience, which we've all kind of experienced at certain stages in our life. What I really want for us to do in this series of talks is explore the concept of pain. If you are suffering from pain or different kinds of pains, then hopefully you'll find some of the answers here. At least certainly some enlightenment and some solutions to help you manage and deal with pain and function as best you can. So I think the first thing to appreciate with pain is all is not what it seems. Okay, we are very much, I think, conditioned very much from early childhood to associate things like pain intensity with tissue damage. In other words, if I break my leg, it's going to hurt a lot more than if I bang my elbow. But the first thing I think to really kind of appreciate about pain is one is how we have been conditioned to think about pain, because pain intensity and tissue damage are generally very poorly correlated. So if you have experienced intense pain, debilitating pain, perhaps you've not been able to get out of bed, not been able to move, function. Again, the positive aspect to all of that is it doesn't necessarily mean that the tissue damage is equal to the severity of the pain. Think of a paper cut, okay? If I cut myself with a piece of paper, it can hurt like hell. Okay, but there's not necessarily a lot of tissue damage. Okay, conversely, I'm sure you've all experienced waking up one morning with bruises on your legs, not knowing how those bruises managed to get there. We've got tissue damage in terms of a bruise, but we have no pain. So I think the really important thing and the key message I want to get across here in the first instance is severity of pain and tissue damage aren't related, or as much as they are as related as much as we have probably thought about them. And that's a really important concept because I think that puts a very positive spin on a lot of people who may be experiencing pain, you know, and 80% of people will experience back pain at some stage in their life. You know, for many people that pain quickly rectifies itself. But for other people, that pain kind of lingers. And when it lingers, obviously you go and seek professional help. Towards pain in mainstream medicine is very much centered around what we call the biomedical and structural approach, which is again trying to narrow things down to single causes of your pain. For instance, your ligaments, your discs, muscle spasm. And on the other side of the equation, you have what we call the biopsychosocial approach to pain, which is looking at things like x-rays or the structural anomalies that you may present with as just one part of a bigger puzzle. Okay. This is because pain is viewed very much in a multi-dimensional perspective. In other words, there's many different contributing factors that may be going in towards the reason that somebody is in fact in pain. Okay, and during the course of these talks, we will try and pick up on certain ones of these, and there'll be a video presented which is a very good analogy using a cup analogy, and we're looking at the cup, which is you. Okay, and within that cup, okay, we're looking at structure, biology, okay, but then you're also looking at maybe support at home, stress at work, kids, socioeconomic problems, and slowly that cup starts to build up, okay, until it overflows, and the overflowing is just representing pain, okay, and for some people we're able to help rebalance and reconfigure those certain components of their cup, and their pain settles down and they can carry on. But for some people, even when they've settled those things down, pain can still persist. So again, we'll be looking at ways in which we can increase the capacity of our cups so that we can handle more. We will be looking at certain ways of modifying symptoms should you have flare-ups, and we'll be talking about flare-ups. And we'll also be talking about exercise and pain, which is quite an interesting area to kind of diverge into. And it's, again, a lot of what we'll be going through hopefully will be eye-openers in terms of the way you've thought about pain, maybe the way you've approached pain or painful conditions. We will discuss potential recovery programs and online resources which you can use to help facilitate and support your recovery. Primarily, I think my biggest goal as an allied health professional and an osteopath is most definitely to try and give patients an element of control, and from that element of control comes understanding of pain, understanding of triggers, and then strategies in which to use to help things settle down, calm down, but also for managing to cope with such flare-ups. So that's all from me today. Just a little bit of an introduction into pain and some of the areas we will be looking at during the course of some of these videos. The key message I think really from today's is, first of all, that severity of pain doesn't equal tissue damage. Okay, so if you are experiencing high levels of intense pain, the positive message out there is that, number one, it doesn't equate to tissue damage, and there may be other factors at play, okay, and if we can help identify those other factors at play, we give you that element of control, and then really to try and then give you tools so that you become empowered to be able to go on and be on top of your pain and live life in spite of pain. So that's all from me now. I hope you found that interesting. Please feel free to drop some comments or message us. Again, one of the biggest aspects of recovering from pain is support, and it's one of the reasons I'm so happy to be associated with We Connect, the FIMDEM charitable organisation, because we as practitioners can support you in trying to make sense of your pain and understand how you can function in spite of your pain. Thank you very much for joining me. Bye now.